We're going to rattle the chains of a lot of people today, especially the periodontists out there, a lot of you GPs. We're going to tackle a controversial topic that nobody wants to talk about, but I've got to tell you what's going on with our company and what we've been doing. The question is periodontal disease curable? Can we eliminate periodontal disease from our patients, put them back on 6-month recall, whatever you want to call it? We begin our podcast right there.
Welcome, all of you fantastic dental podcast listeners, to the My Practice, My Business Dental Podcast Show, where we help dentists profit and thrive with excerpts from the clinical business of dentistry training here at My Practice, My Business. We'll be addressing and answering questions with current trends dentists and their teams face each and every day in their pursuit of this wonderful career we call dentistry. And now the host of our show, the clinical director and president at My Practice, My Business, Dr. Rob Thorup.
How many times do you refer a patient out to the periodontist only to find that patient get swallowed up into some, dark hole, some abyss? They're gone forever and ever. And you see them once in a while for an exam, and you find out that they're on 3-month recare. They're 3-month, periodontal maintenance. Periodontal maintenance. What are we really maintaining? Are we maintaining infection? What does that maintenance really mean? With every team training that we do here at My Practice, My Business, I gather the wonderful hygienists up front. And we have a hygienist roundtable. It's extremely fun and very thought-provoking. In this discussion, I ask them some very important questions. I mean, honestly, microbiological questions, histology questions, clinical experience questions. Please allow me just to jump to their answers for now. I'm sure that you can figure out the questions that I ask, but here are some of their answers. I'll give you 4. 1, quote, Dr. Rob, I think we're really just maintaining infection, not eliminating it. This just doesn't make sense. End of quote. 2, quote, I've always felt that periodontal disease can be eliminated, but not with our current treatment protocols, and especially not with my office treating to the insurance limitations. Our office manager tends to take control of that. We really can't treat it, and we don't have the time to treat it because of how much they pack our schedule. But I think that if I was given enough time, I could actually cure it. End of quote. 3, quote, I have no idea why we don't use antibiotics. Using direct placement makes sense. Not using them doesn't make sense. End of quote. Number 4, all of our patients bleed in almost all the areas of needed SRP at the 6-week exam. And all of them continue to have forever periodontal disease, if I'm being honest. End of quote. Those are some pretty powerful statements from these wonderful hygienists. There are even more answers to our questions that I could cover with these fantastic people that we put in our offices to do hygiene. But I know you are seeing where this is going, or at least I hope you do. I think the first thing we need to do is actually define what periodontal disease is. And I oftentimes, unfortunately, see periodontal disease and periodontitis interchangeable. And I think that people use those two terms synonymously, but are they? According to the, when you hear the definitions, you can actually hear these places actually using them interchangeably a little bit. According to the Mayo Clinic, quote, periodontal disease is a serious gum infection that damages gums and can destroy the jawbone. Periodontitis is common but fairly preventable. Preventable? Interesting. The cause is usually poor oral hygiene. Yeah, no kidding. Periodontitis can lead to tooth loss. It's a risk factor for heart and lung diseases. Symptoms include swollen red and tender gums. Treatment includes professionally cleaning the pockets around teeth to prevent damage to surrounding bone. Advanced cases may require surgery. End of quote. I find it interesting in that quote, and please forgive me. Some of you are going to read the blog post, and I'm going to go off. I usually have a fun outline, but I'm going to go off outline here for a minute. I find it interesting that they say that it's a risk factor for heart and lung disease. We have a lot of evidence that it affects the heart, lung, liver, kidneys, brain tissue. I mean, brain cells. It's like unbelievable, the stuff that we have out there, but it seems to be downplayed often. Just saying. Now let's look at what causes periodontal disease according to the Mayo Clinic. Quote, here we go again, though. I'm going to break into the quote here. They're starting out periodontitis. Quote, periodontitis is common but largely preventable. It's usually the result of poor oral hygiene. Brushing at least twice a day, flossing daily, and getting regular dental checkups can greatly improve your chances of successful treatment. What is successful? I'm going to stop the quote here. What is successful treatment? Exactly. The elimination of periodontal disease or periodontitis. Continuing, quote, successful treatment for periodontitis and can also reduce your chance of developing it. End of quote. Let's look closer at the bacteria from the National Library of Medicine by Lovegrove. Between 3 to 12 weeks after the beginning of supragingival plaque formation, a distinctive subgingival microflora predominantly made up of gram-negative anaerobic bacteria, and including some motile species, becomes established. In order to establish in a periodontal site, a species must be able to attach to one of several surfaces, including the tooth, or host-derived substances adhering to the tooth. The sulcular or pocket epithelium also, or other bacterial species that are attached to these surfaces. Bacterial adhesion has demonstrated specifically in the mechanisms involved, and studies have shown that there is a diversity of receptors on tooth surfaces, epithelial, or other host cells and other bacteria. Interesting how it's attaching to all the tissue down the pocket. Continuing with the quote, recent studies have described bacterial complexes that are present in subgingival plaque, and these studies are likely to help in current understanding of the complex ecology observed in dental plaque biofilm. Bacterial interactions play important roles in species survival. Some interspecies relationships are favorable in that one species produces growth factors for or facilitates attachment of another species. Other relationships are antagonistic due to competition for nutrients and binding sites, or to the production of substances that limit or prevent the growth of another species. A number of different bacterial interactions within plaque biofilm have been discussed. In the last 30 to 40 years, a vast amount of evidence has been published to suggest that bacteria are the primary etiological agents of periodontal disease. End of quote. I go into more information on that just a little bit. There's another paragraph that gets in the type of bacteria that are predominantly associated with periodontal disease, but I don't want to bore you to death. But it is the primary etiological agents of periodontal disease. Bacteria are. I want you to think about that for a minute as we move along. So what does the CDC say about periodontal disease? Quote, periodontal diseases are mainly the underlined, result of infections and inflammation of the gums and bone that surround this and support the teeth. In its early stage, called gingivitis, the gums can become swollen and red, and they may bleed. In its more serious form, called periodontitis, the gums can pull away from the tooth, bone can be lost, and the teeth may loosen or even fall out. Periodontal disease is mostly seen in adults. Periodontal disease and tooth decay are the two biggest threats to dental health. A recent CDC report provides the following data related to prevalence of periodontitis in the U.S. It's kind of interesting. 47% of adults aged 30 years and older have some form of periodontal disease. That's a lot of people. Periodontal disease increases with age. I'm getting up there. 70% of adults 65 years and older have periodontal disease. I'm not quite in that category, but getting there. This condition is more common in men than women, those living below the federal poverty level, and those with less than a high school education, and current smokers. The causes of periodontal disease: bacteria in the mouth infect tissues surrounding the tooth, causing inflammation around the tooth, leading to periodontal disease. When bacteria stay on the teeth long enough, they form film called plaque, which eventually hardens to tartar. This is CDC talking. Also called calculus. Tartar builds up, can spread below the gum line, which makes the teeth harder to clean. Then only a dental health professional can remove the tartar and stop the periodontal disease process. Then it gives warning signs, bad breath, swollen gums, tender gums, painful chewing, loose teeth, sensitive teeth. Kind of sounds like jury duty, the Grinch. Risk factors: smoking, diabetes, poor oral hygiene, stress, heredity, crooked teeth, underlying immunodeficiencies, fillings that have become defective, taking medications that cause dry mouth, bridges that no longer fit properly, female hormonal changes, such as with pregnancy or the use of oral contraceptives. Prevention and treatment. CDC goes on. Gingivitis can be controlled and treated with good oral hygiene and regular professional cleaning. More severe forms of periodontal disease. See, we talked about gingivitis, but now we're getting into periodontal disease. More severe forms, and again, this is the CDC talking, more severe forms of periodontal disease can also be treated successfully, but may require more extensive treatment. Such treatment might include deep cleaning of the tooth. By the way, I'm going to end the quote there for a second. I want you to know that we need to stop using detailed car wash, deep tooth cleaning. How about we just tell the patient, you've got infection that you can't reach and it's going to harm you, and this is to be taken seriously. What a concept. Okay, continue with the quote. Such treatment might include deep cleaning of the tooth root surfaces below the gums. Here we go. This is underlined. Continuing the quote. Medications prescribed to take by mouth or placed directly under the gums. And sometimes corrective surgery. End of quote. Wow. It's kind of some interesting information there. Let me point out what a representative with our medical malpractice insurance provider told me about periodontal disease. He pointed out, number one, treatment modalities are antiquated, Rob. Yeah, no kidding. We're going to talk about that. Two, nobody has challenged the status quo of how to treat periodontal disease because what we are doing currently isn't working for the majority of the time. Now, after point two, I want to go back to what the hygienists are saying in the roundtable. When we get them all together and get them out of their caves, what are the hygienists saying? They're saying, Dr. Rob, when we do our 4 quads of SRP, after we've diagnosed it, we do 4 quads. Some of you are still doing 2 and 2. Don't get me into how that would be medical malpractice if that was treated on the medical side. But we are treating to insurance there and not, it's like, let's clean half the mouth and tell the bacteria to not go cross over and back into those zones that just got cleaned out. Okay, brilliant. Okay. Anyway, what we're finding, remember the hygienists are saying, after we do 4 quads of SRP, we go back in and probe 6 weeks later and there's bleeding everywhere still. Patients actually need more SRP, not more perio maintenance. Think that through. Number 3. My buddy with our medical malpractice insurance carrier says we lose lawsuits on this all too often. Number 4, he said the age-old statement of once you have periodontal disease, you always have periodontal disease is ridiculous. Does that mean we maintain infection in our patients' mouths until they die? These are always fun conversations to get into if we can allow common sense to prevail. And I hope y'all allow common sense to prevail in this podcast because we're going to have fun with this. So I asked my good friend and rep with our malpractice insurance provider this question, quote, how would medical treat periodontal disease if they were in charge of its treatment, end of quote. That's what I asked him. I'll just share with all of you what we did years ago. Number 1, we defined the cause of periodontitis as poor oral hygiene. People just don't know how to take care of their oral health. So inflammation of the periodontium is definitely attributed to people, the underlying cause. They lie to you. Oh, Dr. Rob, I brush and floss 50 times a day. I promise. And if we were to go look at their toothbrush, it's probably got dust hanging off of it, right? Well, the second thing that we decided to do is define the etiology of periodontal disease as a direct cause of infection from oral bacteria. Now, I know this is kind of reverse. Periodontal disease has been said to cause periodontitis, and that's true. But we decided to look at it a little differently. Yeah, call me stupid. I'm just a simple person that when I worked EMS and worked the ER, we dealt with infection differently than we do in dentistry. Okay, so we define that etiology of periodontal disease as a direct cause of infection from oral bacteria and other infectious organisms. Now, I'm not going to get into that, but for those of you who are in the Coyce Institute, you know exactly what I'm talking about. Number 3, because the primary etiology of periodontal disease is infection by bacteria, this is our third definition, because the primary etiology of periodontal disease is infection by bacteria and the primary cause is lack of oral hygiene, we changed our dental treatment protocols and adopted protocols we found in medical when they treat infections in or on other parts of the body. Now, that's kind of interesting, right? See, I had a kid that one of my sons was in the Marine Corps, and when he came out, he worked as a wound and parabolic chamber tech for one of the hospital chains here in Utah. He and I would engage in conversation on how they treat infection. And I tell him how the status quo of treating periodontal disease, and he'd look at me, he goes, Dad, you guys are like bass backwards. What is the deal? Why would you allow people what amount of bleeding in the mouth is acceptable? He goes, let me tell you, no amount of infection on a wound is acceptable here where I work. Okay. So point 3 is what we train on in our clinical business of dentistry team training here at My Practice, My Business. We show our wonderful hygienists and docs and all the team members in attendance our protocols for attacking this disease. What disease? Periodontal disease. And our clinical findings since changing our periodontal disease treatment protocols. All of hygienists who are trainees who engage with our top protocols are seeing and experiencing amazing results with their patients, just like we've seen for years in our dental office, instead of the status quo that they've always been seeing. I thought that was kind of interesting. Then point number 4. With hundreds of periodontal disease patients treated to date, and I do mean hundreds, we found that our aggressive protocols have eliminated our patients' periodontal disease by attacking the etiology that causes the disease. And we have been able to successfully move our patients back to regular 6-month recare protocols as they become free of periodontal disease. And their oral health becomes free of what? 4+ millimeter pockets, bleeding on probing, and bone that we actually see healing in the areas. It's still lost, but it heals. That's the triad of periodontal disease. How do we diagnose it? 4+ millimeter pockets, bleeding on probing, and radiographic bone loss. Or may I suggest 3D imaging, cone beams, for looking at where the bone is actually lost. Something to think about. So please allow me to quote what we have been seeing on dental websites from periodontists and GPs who are aggressively treating periodontal disease. It's amazing how the verbiage has changed over the last 5 years, 10 years, 15 years. Kind of interesting because, honestly, 15 years ago, all the websites, everything, once you have periodontal disease, you always have periodontal disease. Periodontal disease can never be eliminated. Periodontal disease, you will maintain that infection for the rest of your life and beyond the grave. That's what we're teaching. Let me tell you what we're seeing. Not only the quotes of the Mayo Clinic and other entities out there, Coyce Institute, other places. I mean, even on the Coyce Institute website, they need to update that website. But we are seeing amazing results with what they're doing. Okay? Here's one. Quote, A person can be free of gum disease with an aggressive approach, end quote. I really want to call that office and say, hey, share with me what you guys are doing. I'll share with you what we're doing, you know. Second one, quote, the dentist can employ methods such as scaling and root planing and direct antibiotic placement to eliminate the disease, end quote. Wow, it's pretty bold, especially since that goes against every periodontist that's out there, especially some here in Utah who are poking fingers at how we're treating this instead of asking us, what are you guys doing that we're not doing? Here's a third one. Quote, surgical procedures are also available to halt or eliminate the disease, end quote. Well, good for that periodontist. I love that guy. Here's another one. Quote, periodontal disease is treatable and can be eliminated, end quote. I loved her website too. That was fantastic. Do those statements sound like the old status quo of once you have periodontal disease, you always have periodontal disease? Because that's what's still being taught in all the hygiene schools from what I have heard from every hygienist that's come through our training. And there have been hundreds and hundreds of hygienists. It's my humble opinion, and far be it for me to be the expert on this, I can only tell you what we have seen clinically. That's all I can tell you. Because I realized that what we were doing wasn't working. And when we changed, it's been working for years and years and years. So it's my humble opinion that we simply don't correctly define or treat periodontal disease. So here's my definitions based on clinical experience and evidence and the actual elimination of the disease in my dental patients. Number one, once you have periodontal disease, you will, with our current technology, always have the effects of the disease, meaning bone loss around your affected teeth. That's number one. Now, to date, I don't mean to tout Straumann's Emdogain here on my podcast. I get nothing from them, but I don't know what's in that magic pixie dust, but I would definitely have the Straumann rep sneak by and take a look at it. And then there's some of you wonderful periodontists out there actually, you know, I hate to say growing bone, but we're filling pockets with bone. So when I say with our current technology, yeah, you're going to have the effects of periodontal disease. We can't grow massive amounts of bone yet, but hey, the future, you know, holds some pretty cool stuff. So we'll see what happens. Maybe in my lifetime, maybe not. Number two, the etiology of periodontal disease, meaning the infection that is propagating the disease, can be cured. Just imagine medical telling a patient, you will always have an infection that is not curable. God. Can we say medical malpractice? I mean, it's like unbelievable where we've gone with this. 3, the underlying cause of the disease can also be eliminated by putting the fear of deity, and this is where we fell, putting the fear of deity in the patient's thoughts, which almost always changes their oral hygiene habits. Doesn't always happen, but it's a major helper when they understand the disease and what it does to their body. Meaning, let the patient know that periodontal disease is nothing to mess with. It negatively affects the heart, the liver, kidneys, lungs, brain tissue. It shortens lifespans and has been known to be fatal. We actually have an example of that here in Utah where a lady was life flighted out, nearly shortened her lifespan like crazy. Long story short, she had forever periodontal maintenance that they were maintaining, and she gets life flighted to the UVU Medical Center. And basically, after her heart surgery, all of her teeth with 3, 4, and 5 millimeter pockets, they were all eliminated. She didn't have any teeth left in her mouth. Cardiac surgeon refused to do the surgery after they biopsied and found that the bacteria that were in her mouth were affecting the condition of her heart. And she had infection, bleeding on probing on all the quadrants. I don't know, something to think about. And then my favorite one, when we were teaching that, young dentist, sitting 3 rows back in our training facility, raised his hand. He said, hey, Rob, can I add to that story? And I never know what's going to happen. Lo and behold, it was his aunt. Unbelievable. Then he added to the rest of that story, which emphasized even more why we do what we do to eliminate periodontal disease. We can either learn and experience how to eliminate periodontal disease and bring our patients back to great oral health, or we can maintain oral infection with forever periodontal maintenance. And that's what all the hygienists are saying, that's what we're doing. We are just maintaining infection. And then I asked the hygienist, what if this was your mouth? How much bleeding on probing would be acceptable to you if it was you? And I'll tell you, it's like this paradigm shift. They're like, none. And I'm like, exactly. It's like having a cut on your arm forever. It's going to fester and fester and fester. And my favorite is take a 6-inch cut on your arm and tell yourself you're going to treat 3 inches of it and have yourself come back a couple weeks later, then you'll treat the other 3 inches of the infection. How's that going to work out for you? That's what we're doing. By the way, that's something that Tracy and I are working with the Utah Dental Association and our state legislature on for 2023. That kind of crap. That needs to stop. That's not in the best interest of anybody in the state of Utah and beyond. We can't allow these insurance companies to dictate treatment, but you've never had to allow them to dictate treatment if you knew how to push back. If you knew how to actually come to the rescue of your patient and be able to perform the dental services that you know how to perform, doc and team members. You don't have to if you know how to push back. And that's what we teach and train on. I'm dumbfounded, absolutely dumbfounded, why periodontists would rather reclassify periodontal disease for the 5th time in my lifetime. I don't even care about the reclassification the last 2. I gave up. I'm like, I use the triad. I use what I was taught out at UOP, and that's what I stick with. And that's what my notes are all centered around. Hey, you either have infection in your mouth or you don't. You either have the signs and symptoms of the infection or you don't. Why don't they instead, and I'm trying to be nice here, and I'm trying not to call out a couple periodontists in the area, and you know who you are. Hope that this somehow finds its way to your listening ear. Instead of reclassifying periodontal disease, why don't we develop aggressive protocols that actually eliminate the periodontal disease like we have done here at My Practice, My Business, other institutions have done, like the Mayo Clinic says we can do, like other thought leaders on websites that I just read earlier have figured out. Why are we treating it to the insurance? Why do we treat it there? That's crazy. Again, at our team training here at MPMB, in the Hygienist Roundtable, one of my questions I ask them is this: how has 4 quads of SRP and forever periodontal maintenance been working out for your patients? How many bleed on probing every time they come in? I love the honesty and integrity of every hygienist we have trained. Oh, there's been maybe, seriously, since 2006, I bet I've had maybe 3 hygienists extraordinaires. Now, you know how I tease a hygienist. I love teasing our hygienists. They're the prima donnas of the office, we know. And, they kind of earn the right a little bit, but I give them a bad time. But, man, I have absolutely loved the honesty and integrity of every hygienist that we have trained. They know the answer. They know we've been treating periodontal disease to insurance limitations, not to the health of the patient. They know their patients actually need additional quads of SRP, not forever periodontal maintenance every 3 months. That's not eliminating it. They know that if it were them, no amount of bleeding on probing would be acceptable. They also know that we are not paid properly and fairly for the treatment modalities that are needed to eradicate periodontal disease. There's a problem. It's kind of interesting when I talked with my son about this. If it was medical treating periodontal disease, they would aggressively go after it until it was eliminated, and it would be eliminated in short time. Otherwise, they would be concerned about medical malpractice. One more observation. If medical treated periodontal disease, what do you think the cost would be? Well, based upon other infections that we see them treat, that cost would run between $17,000 and $22,000. We freak out over wanting to charge a patient roughly $1,500 to $1,800 on 4 quads of SRP. We give away the 6-week ITE examination. I've seen it all on the Utah Dental Networking Group and other networking groups across the nation. Oh, we just do that for free. We give it away for free. We do it for free. Yet, it's like the insurance doesn't pay for it, so we do it for free. But have you ever looked at that code on your insurance contracts, folks? Have you ever noticed that there's a fee attached to it? Oops, there it is. That cost would be between $17,000 and $22,000. I want y'all to chew on that for a little bit till we meet again, and I hope that this has been a awe-inspiring podcast to really chew on and think about. I love how we are treating periodontal disease, and we have. I won't say that we were the originators of how we treat it. No, I learned from people smarter than me. Have we modified it over the years? We have. Absolutely. To the best interest of the patient. And are we paid fairly for it? Oh, a lot more. Well, not $17,000 worth, but a lot more than $1,500 worth. We teach you guys how to be paid fairly for what you do. And what we've noticed is patient compliance in our protocols, patient compliance is nearly 100%. In fact, let me say it this way. The non-surgical approach that we do for our patients with periodontal disease is roughly 95% effective every time. 95%. The other 5% are the ones that sometimes need surgery or you have to take their cigarettes away from them forever. But autoimmune disorders, diabetes, other factors, risk factors, we honestly and truly stay blind to those. We pretend they don't exist, and we treat the patient as if this patient wants to eliminate the disease, and we are their best coaches for doing it. And even those patients end up going on 6-month recare after our therapy is done. That's what's fun. We have been having a ball treating periodontal disease for years. We have been eliminating it because what causes it? Bacteria. It's an infection. So I'm going to say it again. Once you have periodontal disease, you do not always have periodontal disease, but you will have the effects of the disease for the rest of your life. But it doesn't mean you have to maintain the infection. I love this topic. I love chatting with all of you about this. Thanks so much for being with us here today, and I hope you have a great day.
Thank you for being with us today. Since 2006, My Practice, My Business has been teaching dentists and their teams business skills, dental insurance contractual protocols, and state laws governing how to profitably bill patients fairly for the need-based services they provide. What's more, we guarantee our training, unlike other dental consulting companies in the industry. Simply stated, if you don't increase your net revenue, we don't get paid. We call it dental consulting the way it should be. We believe there has never been a more important time than now for dentists to experience and implement our key methods, knowledge, and business training within their dental practices. To learn more about our guaranteed, no-risk clinical business of dentistry training that is changing dental practices for the better, just go to our website, mypracticemybusiness.com, and surf our pages for additional information about our company and the services we provide. When you're ready, give us a call and get scheduled for the most profitable dental business training that you will ever experience. If you enjoyed our podcast, please leave us a 5-star review. If you have any questions, please don't hesitate to call us. Thank you again and have a fantastic day.